Welcome, everybody. All right, I'll let everyone get settled in here. If everyone doesn't mind just muting themselves, that would be appreciated. Okay. So hello and good evening, everyone. Thank you so much for joining us for this Live Right webinar session. This month is in collaboration with Obesity Canada. My name is Anisha, and I will be moderating and hosting this session. So, I want to just do a quick land acknowledgement for the Canadian Liver Foundation. Our national office is located on the traditional territories of the Anishinaabe, Haudenosaunee, Mississauga, and Mississaugas of the Credit First Nation. We acknowledge and extend our gratitude and respect to all First Nations, Inuit, and Métis peoples for their valuable contributions. Non-Indigenous people have an important role as we work towards reconciliation, and the more we take action and speak up in solidarity with Indigenous people, the more we can create lasting change for future generations. For those of you who may not be familiar with the Canadian Liver Foundation, the CLF was established in 1969 and was the first organization in the world created to help people with liver disease. The CLF is committed to promoting liver health and improving the prevention, diagnosis, and treatment of liver disease through our 4 core pillars of research, education, patient support, and advocacy. The CLF has rebranded our webinars to our new Live Right brand, encompassing more of our support and education services. If you have attended any of our previous webinar sessions last year, you may remember these under our Living with Liver Disease brand. But even with this new name, our educational services have been around for more than 25 years, and it continues to serve as a supportive tool for both patients and caregivers, as well as anyone else looking to learn more about liver health. This program provides an opportunity to increase community-based learning about liver health and the importance of liver health in hopes to reduce the incidence and impact of liver disease through prevention, early diagnosis, treatment, and care without geographical barriers. Speakers for our sessions include healthcare providers like today, allied health professionals, subject matter experts, as well as patient advocates. Today's session will be a discussion with Dr. Giada Sebastiani, who will be speaking on obesity and liver disease, and then we will wrap up with a Q&A. Feel free to use the chat feature at the bottom of the Zoom screen to ask your questions during the discussion, and note that questions will be answered at the end. Before we get into the details of the session, though, I do want to do a quick poll with our audience today. So poll questions are an easy way for you to share your knowledge, ideas, and feedback with us. So a few brief poll questions will pop up on your screen momentarily. Some of these will also be included in a brief poll, which we will do at the end, and we do thank you again for participating. Today's session is being recorded and will be available on the Canadian Liver Foundation's Resource Hub, on our website, as well as on our YouTube channel and Facebook page in the coming days. Let me get my polls. So I'll give everyone just a couple minutes to answer this. Joan, I see you have your hand up. Do you mind adding your question in the chat box for me? Okay, just waiting on a couple more people. And then I will end our poll. Give everyone 10 more seconds. Okay, great. Thank you everyone for participating. So I would like to introduce today's speaker, Dr. Sebastiani. Dr. Sebastiani is a researcher and a professor of medicine at the Division of Gastroenterology and Hepatology at McGill University and a clinician scientist at the Research Institute of McGill and their University Health Center. She is the president-elect of the Canadian Association of the Study of the Liver, and she received a medical degree and specialized in internal medicine at the University of Padua in Italy. She has research training at Harvard Medical School, University College of London, University of Bordeaux, and her work focuses on steatotic liver disease, also known as MASLD, liver fibrosis, and non-invasive diagnostic tools in liver disease. Dr. Sebastiani is co-founder of the Canadian NASH Network, co-chair of the first MASLD chapter of Diabetes Canada, guidelines and panelists of the first Canadian liver guidance on MASLD. She's a sole North American representative in the guidelines for the European AIDS Clinical Society as primary reviewer of the liver group. Her research program is funded by the Canadian Institute for Health Research, the Fonds Recherche Santé Québec, the CIHR Canadian HIV Trials Network, and Crohn's and Colitis Canada. I'm not sure what these are, these lines. So Dr. Sebastiani, my first question for you. Most people know that liver is an important organ in the body, but many may not know about the fact that it performs over 500 functions and is one of the main filters in our body. There are over 100 types of liver disease, and this is why liver disease is so important to prevent and manage properly, really to ensure that our bodies are working the way that they are supposed to. How much do people know about liver disease, and what treatments are often recommended for common liver diseases such as fatty liver?
Yes, hi Anisha, first of all, and thank you for hosting me. I'm very happy and glad to be here and having this conversation with you and with the Canadian Liver Foundation, with our guests. So, as you said, the liver is actually an essential organ in our body, and I like to call it as the chemical center, actually, of our body, and it's really basically filtering many of the products that are coming, for example, from the intestine, from the gut, and from also some medication, the toxins, and anything. So it's really an essential organ. So liver diseases are actually very common, as you said, and there are many of them. So in terms of the knowledge, I actually often find that to patients and to people in general, the liver is a little bit more mysterious organ compared, for example, to heart or compared to the brain or other more approachable, also visually approachable organs. So, but at the end of the day, actually, liver diseases, for example, especially cirrhosis, for example, which is let's say the more advanced disease that may be caused by many situations to the liver, is actually increasing very significantly in terms of affecting populations in North America. And actually, the burden of this cirrhosis of the liver is higher, it has been reported higher than breast cancer or to colon cancer, which are much more known, kind of diseases.
Wow.
So, yeah, so I think that we really, this kind of events, because this kind of conversation are especially important for us and for our guests tonight to get really to know the liver and to know that this is can be affected by many diseases. Some of them are quite serious, as you said.
Absolutely. Absolutely. So many people know that obesity has linked links to poor health outcomes. Many might not know, though, that obesity is a chronic disease where excess or abnormal fat tissue impairs your health. So, when looking at the overlap of liver disease and obesity, this fat buildup can often happen in the liver quite quickly, leading to fatty liver disease, which can affect liver function. Obesity is quite a complex chronic disease with, genetic and brain-based components. And while nutrition and exercise are important for both liver disease and obesity management, sometimes the eat less and move more approach doesn't always seem to be successful. So what are some of the treatments that are effective in treating obesity?
Absolutely. I think this is a key actually, because as we will discuss a lot during this conversation, liver disease and obesity are very, very much linked. They are kind of two friends or that go together, very frequently together. And I think the most important point here is what you said. The eat less, move more is like a one size fits all approach that is not working anymore, because the most important approaches in treating obesity, and consequently for many things also liver diseases, is really a more multi-target approach, where for sure nutrition and lifestyle modifications remain kind of the cornerstone to treat obesity and also liver disease, many of the liver diseases. But this is not enough, because there are many other situations, hormonal imbalances, and many other conditions that may cause obesity. So for sure, there should also be consideration for example, for pharmacotherapy. In selected cases, also there is surgery to reduce the dimension of the stomach. And last but not least, it's very important to remember the behavioral interventions, because in many patients with obesity and also with liver disease, there is some psychological conditions also that should be addressed. For example, what we call binge eating. So this, of course, eat less and move more. Some of these conditions will not be addressed by that. So this is what is the most important thing, really. Effective treatments in obesity are those who are multi-target, not just eat less and move more, but consideration for pharmacotherapy when needed, for bariatric surgery when needed, and also treating the underlying psychological condition who may bring to the binge eating and also to obesity.
Great. Thank you so much. I think that really gives people a background on how obesity might manifest in some people. As some people might know, there are over 100 liver diseases that exist, and there are a few liver diseases which can contribute or have overlap with obesity and can be exacerbated by obesity. So what are some of the risks of living with both obesity and liver disease?
Yes, absolutely, Anisha. I think we have to be reminded that basically about 80–90% of people living with obesity will also have some sort of liver disease, mostly what was called until a few months ago fatty liver disease. Now we call steatotic liver disease, which is a difficult word, but basically means fatty liver disease. So 80–90% of people living with obesity will have some form of liver disease, mostly fatty liver disease. So there is a very close link between obesity, especially abdominal obesity, and liver disease in the form of fatty liver disease. So these two conditions, when present at the same time, can actually aggravate some other conditions. For example, cardiological conditions. People who live with both fatty liver disease and obesity may have an increased risk for cardiovascular disease. This is very important to be reminded that the number one cause, unfortunately, of mortality for people who live with fatty liver disease is actually a heart attack or cardiovascular complications. So this is very important, but also the presence, concomitant presence of obesity and liver disease, especially fatty liver disease, can increase also the risk of diabetes, can increase also the risk for other organ dysfunction. For example, kidney, also kidney can be affected, and there is a higher risk of getting kidney disease in patients who live with fatty liver disease. And last but not least, and just to mention a few, there is an association between fatty liver disease and also obesity with some forms of cancer, unfortunately, which are not hepatic cancer, no liver cancer, but outside the liver. So even if someone who has fatty liver disease, because the fatty liver is actually causing some inflammation in the body, this can increase the risk also of some type of cancer. And the same happens, unfortunately, in people living with obesity. So the combination of the two may not be very good in this sense.
Yeah, absolutely. And that is definitely a reason to try and be more aware of each condition and both of them together, certainly. So liver disease is correlated with many other conditions and diseases like we just talked about, including obesity and vice versa, with non-alcoholic fatty liver disease, now known as metabolic dysfunction-associated steatotic liver disease, which is a mouthful, also known as MASLD. It can reduce, working on your MASLD can really help reduce the amount of fat buildup in the liver. But can you discuss the relationship between the two diseases and what the role of obesity management is in the context of managing a liver disease? And in your experience, do you discuss obesity management when treating conditions like fatty liver disease, for example? And what would that look like?
Yeah, that's actually an excellent question. The link between obesity and fatty liver disease or MASLD is so tight that actually any weight loss will improve the liver. So the first, I think, important point, of course, approaching the weight loss with a multidisciplinary, multi-system approach, as we said before. But any weight loss basically will actually positively affect the liver. We know that even if a patient has liver cirrhosis, so scarring to the liver, if the patient loses weight, we know that actually cirrhosis, even the scarring in the liver, can regress, can reverse, because the liver is a very is an organ. I like is an organ that forgives insult. I like to say also always like that, is a very forgiving organ. So if I do something nice for my liver, even if there is scarring in the liver, even if there is cirrhosis, the liver is actually capable of forgive what happened to him and to regenerate. So even to heal some of this scarring. Because of that, weight loss associated, of course, in the same way with obesity, is actually first-line treatment for fatty liver diseases, for example, MASLD, and also for liver cirrhosis, even liver cirrhosis associated to MASLD. So this is the first line, and this is something that we recommend to all patients, of course, with by mentioning that the approach should be probably the binge eating if present, pharmacotherapy if necessary, and in that sense, Anisha, I think that it's not just the diet and the physical exercise that some patients may need, but may also need pharmacotherapy. And we know now that there is this, there is a lot of attention, for example, to what they are called the GLP-1 receptor agonists, and we know it's also called Ozempic or semaglutide, for example, for the most. And there are several molecules in that category of therapies, in that category of medications. Those medications which are used for the treatment of obesity and also diabetes are also have also positive effects and positive results on the liver, because just the fact of losing weight will actually positively affect our liver. So the other thing is that when I see a patient, for example, with muscle D who lost weight in the previous months, I see that if I repeat an ultrasound or a special test, which I call fibroscan, the fat goes away very fast from the liver. This is very interesting. It's really something that happens very fast. For the fibrosis, the scarring, the cirrhosis may require more time. But for the fat, for the steatosis inside the liver, this goes away very fast. And the patients, maybe the people think they need to lose a lot of weight, but actually even 5% of the body weight, if a patient is able to lose 5%, this will already reduce a little bit of the fat in the liver. If instead we lose more than 10% of the body weight, then this will also be able to improve the scarring into the liver. So these are not huge numbers, but any intervention in this sense will have a very positive effect on the liver. So the two conditions are very much intertwined, and something that is treating obesity will also consequently treating the fatty liver condition and the muscle D.
Great. So it does sound like something like obesity would be treated in tandem with a liver disease and kind of as part of a liver disease treatment
Exactly.
in your
That's
experience.
a very nice way to put it. Absolutely.
So, what are some of the barriers that someone might face in getting obesity care when also managing a liver disease like MASLD or others? And how can someone advocate for their care to have both of their conditions managed properly?
Yeah, that's actually a very important question, because the barriers that I found that you have to know, Anisha, that about 60-70% of the patients that I follow in my clinics, I follow them for muscle D. So really, this is the preponderant part of the people who I follow in my clinics. So the challenges that they experience, I think they are really, first of all, they are related to access to some of the services that are really essential in a holistic, a comprehensive approach to muscle D and to obesity. For example, access to a nutritionist. Nutritionist is very important. A conversation with a nutritionist, and even better, a regular follow-up goes a long way to provide motivation, to provide a reminder to the patient that you see, I have an appointment with a nutritionist, so I will always try, to follow the instruction and their very nice advice. So first of all, access to nutrition remains an issue outside the big hospital and university hospital. The second, along the same lines, I found that access to behavioral therapy, it's also a problem. This is also a barrier. There are not enough psychologists or specialists in that who can advise our patients. And a binge eating disease, for example, or disorder, should be treated in order to allow our patient to lose weight in an effectively, in an effective way, for example, with the nutrition and the lifestyle. And the other thing is that I think that there is a lot of maybe misconceptions still on the need on some patients of pharmacotherapy, some of them even bariatric surgery, so reduce the dimension of the stomach. These interventions actually very effective, not just to improve the obesity, but also to improve the liver, as I said, because the weight loss will significantly improve the liver, both the muscle D, so the fatty liver, but also the scarring. So I think the most important thing that the patient can do to advocate properly is really, first of all, to have a conversation with the doctor. In the previous question, you were saying, do you discuss weight with your patient? I always discuss weight with my patient. I tend always to first ask the patient, is that okay if today we discuss your weight, in the context of liver disease? Then when the first time I see them, they tell me, yes, it's okay, then we do it on a regular basis. But I think it's very important to kind of approach this subject in a very respectful and bilateral way, so that it's really like a double way. It's a double way opening between the healthcare professional and the patient in this sense. So this is the first thing. And I think also, so advocate for an open conversation with the healthcare professional. If there are concerns from the person, from the patient who is living, for example, with obesity about liver disease, just ask the healthcare professional. For example, I had some patients living with diabetes who, when we did some educational activity, they went after to their family physician and said, I heard that people with diabetes can have high risk for fatty liver disease, muscle D. Can you tell me more about that? So even starting, with the family physician, can we have a conversation about that? And from that, go to the next steps, nutritionist, if needed, behavioral intervention, and so on. So I think the first advocate is the patient himself. We now really try to advocate for the person himself to be informed, like a patient-centric. Really, we want to empower, I think, people, even more than the healthcare professionals, to give them the tools to advocate for themselves. So this is the most important thing, in my opinion.
Absolutely. Absolutely. That was so well said. So kind of going off of that, what are the challenges that you find as a healthcare professional with treating a patient with both liver disease and obesity that maybe you haven't already touched on?
Yeah, I think one of the, beyond the access to the services in terms of the interventions, the other problem is also to diagnose the condition. So basically, if we consider that about 80–90% of people living with obesity will have a muscle D, it's obvious that these numbers become very big. So from a healthcare system perspective, would be very difficult to look, for example, for cirrhosis in all these patients, of course. So because the diagnostic tests are limited. So this is one of the challenge. So we don't have resources to diagnose muscle D to all patients. Do we need to diagnose muscle D to all people living with obesity? I don't think we need to diagnose muscle D. What we need to diagnose is actually if there is scarring. So that is very important. So when there is a suspect, there are some guidelines that we use in clinical practice. When there is a suspect that, for example, a person living with obesity may also have scarring, and there are some indicators in the blood test, for example, there are simple parameters that we use in clinical practice, and we tell the family doctors about that, then these patients should be also referred maybe to a hepatologist or to do some extra tests, for example, some special ultrasound, which is called fibroscan. So my challenge in this is also diagnostic, beyond the limitation on some of the interventions. So I think we need to provide more tools, especially to the family doctors, to be able to diagnose when a person living with obesity may actually have scarring. So, and this, we can do this, for example, by advocacy, by providing educational tools, and by doing conversation like tonight, discuss about this very close link between liver disease and obesity.
Amazing. Thank you. So that very, very easily leads into our next question, which is, what can we do to make liver disease and obesity treatment better? And what are the associated challenges that we're currently facing in making these improvements?
I think one of the most important challenge, actually, Anisha, you said it yourself. The eat less and move more. So this is a challenge. It's a misconception that is still quite eradicated, probably. And I think this is something that we should really speak, discuss, and have educational events and nights like this, evenings like this, where do we discuss about that. This is the most important challenge, because I have many patients, and I'm sure my colleagues who actually treat obesity, they have even more experience in the sense that they really don't eat that much, but they don't lose weight. So they really don't lose weight despite their efforts. Of course, there are also problems related, when someone, for example, going the menopause, there are some hormonal changes, and this can lead to more difficult possibility of losing weight. But overall, the most important challenge is the misconception about the treatment of obesity and of muscle D. The second, which I think is even more important, is actually that unfortunately the current food market, I don't think it's helping us or our people or our patients, because, for example, we know that there are still too many products in the markets that are very dangerous, both for the metabolic health, so for obesity, and for muscle D. All these snacks, these soda drinks, there is not enough protection on these products towards especially our children. So there is a lot of marketing about some of these products, which are very actually deleterious for the metabolic health and for the liver. So I think this is another action that we should do, and that we should advocate for protecting and for proposing as much as possible marketing of healthy food, especially to the young generation and to the children.
Certainly, certainly. So as we know, liver disease, as we talked about, is often tried to be managed through diet and lifestyle, and for some of those other interventions like psychological intervention, pharmacotherapy, bariatric surgery. They're quite complementary to one another in many ways, but there are also a lot of attention on medications for obesity management, such as semaglutide. Are these medications also indicated for liver disease, or does obesity management using these medications have any kind of other effect on liver disease?
Yeah, that's an excellent question, actually. So the medications like semaglutide, so these medications are used in obesity management and also for the management of diabetes, by the way. There is not a direct indication for liver disease for muscle D, for example. They are still not kind of approved as a treatment for muscle D. However, because of their important effect on the weight loss, and especially also on controlling metabolic health, for example, if there is associated diabetes, the guidelines, the medical guidelines, recommend prioritizing in patients with diabetes, for example, this kind of medication, especially if there is a coexisting liver disease like muscle D. So if someone has to choose a medication, for example, to treat diabetes, someone who has diabetes and muscle D, then it will prioritize this kind of medications like the semaglutide, which have also a positive effect both on the weight and on the metabolic health. So in this sense, we tend to use them in this association between diabetes, obesity, and muscle D. So in fact, does obesity management using this medication have impact on liver disease? Absolutely it does. We still don't know how much effect it has on the scarring to the liver. However, we do know that for sure they have a very important effect on the steatosis, on the fat, on the muscle D in the liver. Because when people lose weight, they will also lose the fat in the liver. So it does have an impact on the liver.
Absolutely, absolutely. Are there any reasons perhaps not to use these drugs or any special considerations that someone might think of when using these drugs with someone who's living with a liver disease?
Well, I think the most important thing is always also in this sense, also for the pharmacotherapy, never one size fits all, because any patient is different. Any patient has comorbidities. Many patients have also comorbidity, are taking other medications. So it is especially important to take into consideration individualization, the individual characteristic of the patients, because so, for example, we know that semaglutide can give some gastrointestinal side effects. So if we have a patient, for example, who has already some problems to the intestine, gastric problem in the stomach, or some kind of predisposition to have this kind of problems, they may actually experience side effects. So I think the most important takeaway for this question is really individualization of the use of these drugs, and consider the single patient with his own comorbidities, with his own characteristics, and then discuss very attentively and take the decision in the context of both muscle D and obesity.
Absolutely. Absolutely. And, you know, we've seen that it has an impact, but I guess what does success look like in terms of impact when looking at obesity management and liver disease management combined?
Yes, that's also an excellent question. When we consider a patient who was both is living with obesity and with the muscle D, for example, as I said, I think what we consider successful is a weight loss of possibly of more than 10%, because that would actually reduce also the scarring into the liver. But probably the most important point of success is sustainability. So unfortunately, we know very well that there could be something that is called the yo-yo effect with the weight loss. So someone loses weight, but then it's also easy to gain back. It's very normal, metabolism and hormones changes and so on. However, the sustainability, so the maintenance of this is the most important. That's where the treatment, for example, of binge eating, or the role of the nutritionist, so the education, the behavioral intervention come into effect, because they can actually guarantee the long-term sustainability of this weight loss. And of course, success is also that a person not just loses weight with the diet, with the pharmacotherapy, or with the bariatric surgery, but also integrates into his regular lifestyle, regular physical activity. And the reason why I stress very much physical activity with my patients is because physical activity has a myriad of positive effects. First of all, it's a very potent antidepressant. So because of all the production of natural endorphins when you do exercise. Two, when you do physical activity, especially the guidelines recommend moderate aerobic exercise, for example, in patients who have muscle D, this will also give some cardio. So we will also train our heart, we will do some cardio fitness as well. So we can also reduce a little bit, this increased risk, for example, for cardiac problems that people with obesity or with muscle D, they have. So I think that this is especially important. So the sustainability of a weight loss and the integration into their regular, daily activities of regular physical exercise. And I really would like this to stress when we speak about physical exercise is to start small. I never think that a person should start running a half marathon, but even a small thing integrated in the daily life will actually make a change.
Oh, excuse me. Absolutely. I think small and steady always seems to win the race, right?
Absolutely, totally.
So, in terms of research, is there any upcoming research on obesity and liver disease, or any treatments which people can maybe expect coming soon that will improve liver disease and obesity management?
Yes, in fact, there are actually several new medications and pharmacotherapies which are in the same and similar category, for example, of the semaglutide, and which have been shown the results at recent conferences of the liver, American and European conferences, which they actually show to also improve the scarring in the liver and not just the fat, the muscle in the liver. There is also another category of medication, which is, it's a difficult name. It's called SGLT2 inhibitors. But it's a medication, it's a category of medication also used in patients with diabetes, for example, which also seem to improve the metabolic health and also muscle D. So there are actually, the horizon is bright in this sense, because there are several pharmacotherapies on the pipeline, which will both help obesity and also muscle D and liver disease. And I think this is very important for our patients and for the people who live with obesity and with muscle D, because there is a lot of research going on. There are many people who are working to provide a better management and a better treatment for these two conditions together, always in the optics of integrating this with a more general change in the lifestyle and so on.
Absolutely. Absolutely. So, I mean, we've talked a lot about it, but just to give you an opportunity to share any other kind of key bits of information about what people might want to know about obesity and obesity management if they're living with a liver disease, and maybe vice versa.
Yes, I think the most important concept is that the liver disease and muscle disease specifically and obesity are really like twins. They go so much together that basically we almost consider almost that any person who lives with obesity may have muscle D. It's important to say that in most of the cases, muscle D doesn't give scarring cirrhosis. It's about 20%, that 30% of the patients who have muscle D will experience also the fibrosis, the scarring, and finally even some cirrhosis, some form of cirrhosis. So not everyone will develop cirrhosis, but because the presence of muscle D also gives this additional risk for cardiovascular disease. I think it's still very important to try to achieve metabolic health, because this will also affect the liver, the cardiovascular risk. But the two conditions are so much intertwined that if you improve one, you will also improve the other, and vice versa. The most is that if you improve obesity, you will also improve muscle D. So these are very important points, and I think that it's very actually rewarding for a person to know that he lost some weight, even not too much, but 5% of the body weight. He repeats a fibroscan, a special ultrasound, and he sees that the fibroscan improved. So this is very rewarding for the patient, you know. They see a number going down, or they see that the liver test in the blood test are going down, are improving. This is very rewarding. It's a satisfaction for both the person and for the healthcare professional.
Absolutely. Absolutely. It can definitely make people feel motivated to continue with the healthy
Absolutely.
habits. So, what key pieces of information do you think should be provided to the general public to help prevent liver disease and obesity?
So the first is really that it's very important. Nutrition remains a key. So it's really, there was also a few months ago, couple of months ago, there was also there is a nutrition month actually
Yes,
in Canada. So nutrition is really at the key of obesity, at the key of muscle D, and the key of diabetes, at the key of all these metabolic conditions. So I think the most important thing is educate people on which are the foods that are good for the liver, which are the foods that are good for the metabolic health of a person. This is the most important thing. But the second is also to provide people the means of buying, because there is also a lot of food insecurity, unfortunately, around. So education is good. People need to know which are the best food for the liver, but also we need to combat food insecurity. And the third is education about which food, drinks also are detrimental for both metabolic health and for obesity and for muscle D. And I have to say that the worst of all would actually be fructose enriched drinks. So all these drinks which are full of sugar, they are probably one of the most important driver also of increasing obesity rates in children. So these are the three things that I would say, Anisha.
Yeah, absolutely. And I know that sugar sweetened beverages are something that is quite a hot topic these days, and definitely something that can contribute to several conditions, including obesity. So, second last question. So what actionable advice can you provide to someone who is managing obesity and liver disease to improve their liver health and their overall health starting today?
Yes, so the first thing, it's to start some exercise. It doesn't matter how small it is. If someone is not exercising, to start, even small, it doesn't matter. If someone is already exercising, increase a little bit. Small steps, achievable goals. This is the most important thing. Because then when someone starts small and progressively increase, this will be integrated in the daily life of a person, and then the results will be sustainable. This is the first thing. The second thing is really to get to know the foods that are good for the liver and for the obesity. So, for example, we know that the Mediterranean diet, the so-called Mediterranean diet, is the one that has been studied the most for muscle D and has a lot of very positive effects also for cardiovascular disease. So, which means increase the consume of legumes, increase the consume of fruits, of vegetables weekly. This is essential. Decrease, on the other side, the consumption of refined sugar. And as Anisha was saying, as you were saying, Anisha, also all this enriched sugar, fructose beverage, these have to be abolished completely. And also, unfortunately, although it's very popular and very loved, I know in Canada and in general in Western countries, red meat has been associated with muscle D. So try to minimize the consumption of red meat, because this has been associated also with muscle D. So these are small interventions. And the last but not least is coffee. Coffee is actually it's interesting because it has been associated with the reduction in even in inflammation, and even in some studies in fibrosis. So black coffee seems actually to be a good friend for the liver, and indeed the guidelines, medical guidelines recommend 3 black coffee a day for people who have any form of muscle D. Of course, if they can tolerate, due to, if they have, hopefully they don't have gastritis or anything that can upset the stomach. But I think these are small, achievable interventions that can go a long way if they are implemented and if they are used on a stable and steady way.
Absolutely. Absolutely. And our website, liver.ca, if you search up coffee, we have a coffee page on there with some more information as well.
That's amazing. Actually, you have to know, Anisha, that when I did an event, educational event on Muscle D, I actually downloaded the informative pieces that were from the Canadian Liver Foundation, and I distributed them to my attendees.
That's fantastic. That's great news.
But
Thank
very
you.
well done.
So, kind of wrapping up our discussion here, are there any final pieces of advice which people may not know about and could be helpful in them navigating the journey of liver disease and obesity?
Yes, I think that the most important piece of advice is start small, don't give up, never give up. Speak with your healthcare professional of concerns, of doubts. Advocate for yourself and for your liver health, because I think that you are the best advocate for yourself. So get information, get education, participate to events like the one organized by the Canadian Liver Foundation and others, and you will see that things will actually improve. The improvement for the liver or for the weight, it may actually be start slow, but then it will continue and it will really go a long way to improve the overall health. So it doesn't matter how small it is, the intervention that you start doing. Just start with something, and then little by little you will increase. Really, I have several people I follow so many patients that they tell me I don't have time, to exercise. But I always tell them this: you have, like when you brush your teeth every morning, you do every morning and you find the time. It's the same. This has to be something that it's integrating your daily life, like brushing your teeth. If it's 5 minutes, 10 minutes, doesn't matter, but it has to become part of the routine. It doesn't
Definitely.
matter how small. Just start, and the results will come actually.
Thank you so much. That is our last question. And thank you so much for all of that incredible information. Before we take questions, I know that there are a couple that I saw in the chat. I do just want to do our last poll of the session where you can share, your knowledge of what you learned, provide us feedback on how we can improve. So I will launch that in just a second, and I will give everyone a couple of minutes to answer that. And we do genuinely appreciate all of your feedback. And then we will move on to questions in a minute as well. We do these polls as part of our ability to hear from everyone who participates, which we always appreciate, be able to continue to improve the education services that we provide, and understand what kind of topics people in our community and obviously the obesity community who is joining us tonight as well would like to see, and get wonderful speakers like Dr. Sebastiani to share incredible pieces of information that hopefully will help everyone in attendance be able to live a little bit of a healthier life.
Thank you, Anisha.
I'll give everyone 30 more seconds or so just to wrap this up. I know there's a few more questions in our first one. This is just to get a little bit more information on the overall webinar experience with the Canadian Liver Foundation. I will leave this poll up for people to continue to answer over the next minute or so, but I will also move on to some of our questions that we have gotten in the chat. One of our questions here is, what are timelines a patient with fatty liver and obesity should be concerned with to take action before it reaches an irreversible stage?
Oh, thank you, Michelle. I think is the name of the lady who made the question.
Yes, from Michelle.
Thank you, Michelle. So, so basically, the most important piece of advice, usually when there is muscle D, is to look, and healthcare professionals do that, if there is fibrosis, if there is scarring, because the muscle D itself to the liver will not create a big problem to the liver, although it can tell you that there is some, metabolic status is not very healthy, obviously. But for the liver itself, the most important thing is when the liver start being scarred. Then when the scar starts, that is actually a sign, it's a red alarm that the liver is actually may progress towards cirrhosis. Actually, even cirrhosis is not irreversible. Even cirrhosis can be reversed in its early stages. So when it's actually irreversible is in the late stage of cirrhosis. In that case, unfortunately, there is nothing else to do but to undergo a liver transplant, which of course is something very major, and there are not enough organs and there is a waiting list. It's something very, very big. It's really a big deal. So anything that is before the stage of irreversibility of cirrhosis, the liver is able to forgive and is able to improve if interventions are done. The only problem is that when there is a cirrhosis, this scarring to the liver, beyond the liver starting maybe not working well anymore, there is also unfortunately an increased risk for liver cancer. So my advice for the patients, the turning point is where there is some fibrosis, some scarring, because although this can be reversed, if nothing is done when there is some fibrosis, the patient will at some point develop and progress to cirrhosis. So with some risk for cancer, if the cirrhosis becomes irreversible, you will need a liver transplant. So when there is fibrosis, when there is some scarring, then this is the time to really be concerned and to start do some active interventions with your healthcare professional.
Absolutely. It's definitely a big wake-up call for many people when they get to that stage. Are there any other questions in the chat that anyone would like to ask? Can stage 1 be reversed? What are the symptoms of the start of liver problems?
Yes, so stage 1 fibrosis, it's a very good, it's a very actually good question, because stage 1, it's actually the stage of fibrosis that is before the stage 2, and the stage 2 is actually, it's called the one that we call significant liver fibrosis. Stage 1 can actually be reversed, absolutely. The problem with the symptoms is that actually muscle D, as many liver diseases, do not give specific symptoms until there is, let's say, a more advanced liver cirrhosis. So this is actually a big problem of liver diseases, and that's why the awareness by the people and by the healthcare professional is so important. When there is one of the tests in the blood test, one of the tests of the liver, it's a little bit high, this is an alarm call and it must be checked. Or when the patient has obesity and maybe some other also comorbidities metabolic, like some cholesterol, hypertension, this is a patient who actually should be investigated for muscle D, even in absence of symptoms. Actually, the first international muscle D day that was done a few years ago was called a silent killer, in the sense that it doesn't give symptoms until it is quite late in the stage. So that's why it's important to know about the disease and to discuss with your healthcare professional.
Absolutely. Absolutely. Well, we're just about at time, but if there are any other questions, I will provide my contact information at the end and I can forward them over to Dr. Sebastiani. So with that, I would like to wrap up today's session. I would like to take the time again to thank our speaker, Dr. Sebastiani, for her fantastic contributions. And as I mentioned, the session will be available on our CLF channels in the coming days. Additionally, you can keep an eye out for our upcoming Live Right sessions throughout the year. Our next session is in July, and that is on viral hepatitis, which will include prevention and management. That registration should be open now, and we have a few other webinars upcoming for the rest of the year. More information on those sessions will be available towards the start of each month. So if you don't see the session posted yet, or there's minimal information, please do check back again in a couple weeks as we are likely finalizing some of those details. Before we conclude, I just want to thank everyone again for attending today's session. And if you have any additional questions, you can contact me at this contact information here. Or if you'd like to stay up to date on anything else liver health related, you can connect with us via our social media channels or send us an email at clf@liver.ca. Thank you once again and have a great evening.
Thank you, Amish, and thank you, everyone. Bye.
Thank you, everyone, for attending.